Did you know that many doctors can immediately recognize serious health problems just by spotting certain hygiene mistakes in their older patients? What look like small, harmless habits may actually be quietly signaling dangerous conditions developing in your body right this moment. What's even more alarming is that countless seniors don't realize they're making these daily mistakes that could put their health at risk without them ever noticing. In the next few minutes, I'm going to walk you through 7 personal hygiene habits that doctors instantly pick up on when examining older adults, and how correcting these mistakes could genuinely protect your health, or even save your life, or the life of someone you deeply care about. The information you're about to hear isn't something people talk about much, isn't covered in school, and is rarely mentioned during doctor visits. Yet these simple insights could be the difference between enjoying a strong, healthy life as you age, or facing preventable health issues that steal your independence, mobility, and quality of life. Let me share the story of Edward, a 76-year-old retired architect who believed he was taking good care of himself. Raymond was well known in his neighborhood, stayed active with community events, and loved taking long walks nearly every evening. During what he assumed would be a quick appointment, his doctor immediately spotted several hygiene-related red flags that showed Raymond had been developing a health issue for months without noticing any symptoms. "I honestly had no clue," Raymond told me later. "I thought everything I was doing was fine. If my doctor hadn't recognized what those small hygiene issues really meant, my situation might have turned out very differently." Today, I'll show you exactly what those mistakes were so you can avoid ending up in the same situation. Even more important, I'll tell you step by step what to do instead. Straightforward changes that could add years to your life starting right now. Mistake number 1. Skipping proper oral care. When did you last pay close attention to your toothbrush? Does it look worn out? Are the bristles bent? Do you brush thoroughly twice per day? And here's something many people don't realize. Poor dental habits aren't just about breath or teeth. They're strongly connected to heart disease, strokes, and even memory decline. Geriatric experts at Harvard Medical School have shown that bacteria from untreated gum disease can enter the bloodstream and trigger serious heart complications. Their research found that older adults with poor dental hygiene are up to 3 times more likely to face cardiovascular problems compared to those who care for their teeth consistently. But let me give you a real example. Meet Patricia, a 69-year-old retired librarian from Colorado. She ignored her tender gums for months because she assumed it was just part of getting older. "I didn't think it was a big deal," she admitted. But during a routine health check, her heart specialist found inflammation in her heart valves caused by bacteria that had spread from her mouth into her bloodstream. The doctor warned her that if she had waited just a little longer, the damage might have been permanent. So what should you do immediately? Take a good look at your toothbrush. If it's older than 3 months or looks worn, throw it out and replace it today. Even better, choose an electric toothbrush, which removes significantly more plaque than manual brushing, according to research from the University of Pennsylvania's dental program. Brush twice daily for 2 full minutes. Set a timer if you need to. Always floss before bedtime, and never skip your dental visits, whether you have your natural teeth or dentures. Do your gums bleed? Do they feel swollen? Those symptoms aren't simply part of aging. They're your body's alarm system, and you should take action sooner rather than later. Mistake number 2. Bathing too infrequently and skipping regular skincare. How often do you bathe? Really think about it. Many older adults bathe less often as they age, but your skin is your largest organ, and changes to it can signal internal conditions long before major symptoms appear. Specialists at the Mayo Clinic caution that reduced bathing frequency in seniors can hide early signs of diabetes, liver issues, heart problems, and more. Their studies show that nearly 40% of undetected medical issues in older adults could have been identified earlier simply through paying closer attention to the skin. Take what happened to Leonard, a 78-year-old retired electrician from Ohio. Leonard believed that bathing once a week was plenty, especially during cooler months when his skin felt dry. "I just didn't want to irritate my skin," he explained. But during a visit for a minor concern, his doctor spotted a strange patch of discoloration. Additional tests revealed early kidney disease. The discoloration wasn't caused by bad hygiene, but because the lack of regular bathing made it harder for the early warning sign to be noticed. Here's what to do. Maintain a consistent bathing routine, at least 3 times per week, even if you don't leave the house much. Pick a gentle, fragrance-free soap that won't dry your skin. After bathing, apply moisturizer while your skin is still slightly damp to seal in hydration. Most importantly, monitor your skin for sudden changes in texture, color, shape, or sensation. Do you see flaky areas, redness, odd discoloration, spots that don't feel normal? These are signals your body wants you to pay attention to. Don't ignore them. Mistake number 3. Overlooking nail care. Take a moment to check your nails, both hands and feet. Are they trimmed? Is the skin around them clean? Is there any discoloration? Doctors often look at nails right away because they're one of the quickest clues to overall health in older adults. The American Academy of Dermatology reports that nail changes can reveal more than 20 different health disorders, including anemia, thyroid problems, circulation issues, and even heart disease. In people over 65, up to 30% of internal medical conditions were discovered after a doctor noticed nail abnormalities. Let me tell you about Joanne, an 83-year-old grandmother from Florida. She thought nothing of her thickening, discolored toenails. She stopped wearing open-toed shoes and didn't bring them up during appointments. "I figured it was normal for someone my age," she confessed. When ongoing foot pain finally made her see a podiatrist, the doctor diagnosed a severe fungal infection that had developed over several years. That infection revealed her weakened immune function, which led to diagnosing a more serious underlying condition. So what should you start doing right away? Trim nails straight across with slightly rounded corners. Keep them clean and dry. Wear shoes made from breathable materials and change your socks every day. Never ignore sudden changes in your nail thickness, color, or shape. These aren't just cosmetic problems. They are clues to your internal health. Are your nails splitting, turning colors, becoming unusually thick? These changes aren't unavoidable parts of getting older. They're your body trying to warn you. The real question is, will you notice the signs before it becomes something much more serious? Mistake 4. Poor incontinence care. This is one of the most surprising hygiene problems because of how common it is, yet how many older adults try to keep it secret. More than half of seniors quietly struggle with some level of bladder leakage. But the truly dangerous part is how many try to manage it alone instead of seeking real treatment. Urology specialists at Johns Hopkins Medicine warn that ignoring incontinence can lead to skin infections, dangerous falls, loneliness, and can even hide serious health conditions like bladder or prostate cancer. Their research shows that seniors who properly treat urinary issues experience far fewer complications compared to those who try to cover them up. Take Franklin, a 74-year-old former auditor from Nevada. Franklin felt too embarrassed to mention his occasional leakage to his doctor. He used tissues, changed his clothing several times a day, and assumed he was handling the problem. When he finally sought help after developing painful skin irritation, doctors found a progressing prostate condition that could have been treated much earlier with better results. "My pride almost put me in real danger," Franklin admitted. "I wish I had spoken up the moment it started instead of hiding it." So what should you do if you're dealing with any kind of leakage? First, never feel ashamed to bring it up with your doctor. This is something they address every single day. Use proper absorbent products meant specifically for bladder support rather than homemade solutions. Change them quickly when wet and follow a gentle but thorough cleaning routine to prevent skin irritation. And remember, incontinence is not just a normal part of aging. It's often a sign that your body needs medical attention. Are you noticing occasional leakage? Planning activities around restroom access? Using makeshift protection? Don't wait another day to talk to your doctor. Your safety, and possibly your life, depends on early treatment. Mistake 5. Incorrect ear cleaning. What does your ear care routine look like? Be honest. Are you using cotton swabs and pushing them deep inside? If so, you're making a dangerous mistake that many older adults repeat daily. Many seniors unknowingly damage their hearing or miss early signs of infection because of unsafe ear cleaning habits. Ear specialists at the Cleveland Clinic report that older adults often injure their ear canal without realizing it, and many of those injuries later develop into painful infections. Their data shows that improper ear cleaning causes nearly 40% of ear canal injuries in people over 65, many of which could have been completely prevented. Let me tell you about Marjorie, a 70-year-old retired archivist from Colorado. Marjorie used cotton swabs every morning to clean inside her ears until she punctured her eardrum, leading to a severe infection that spread into surrounding tissues. "I had been cleaning them like that for years," she said. "No one ever told me it was harmful." Marjorie needed emergency treatment and suffered permanent hearing loss, damage that never needed to happen. So what's the right way to clean your ears? Follow this rule. Never put anything smaller than your elbow in your ear canal. Clean only the outer ear with a soft, warm cloth. If you suspect excess wax, use over-the-counter drops specifically made to soften wax and follow instructions exactly. And if you feel pain, discharge, or sudden changes in hearing, see a doctor immediately. Those symptoms should never be ignored. Are your ears itchy? Feeling full? Experiencing odd hearing changes? Avoid trying to fix these issues on your own. They require professional evaluation. Protect your hearing. It's far more delicate than you realize. Mistake 6. Poor foot hygiene. When was the last time you carefully inspected your feet? Not just a quick glance, an actual check of the heels, toes, nails, and skin. Your feet give important clues about circulation and nerve health, which is why doctors always examine them in older patients. Foot care experts at the American Podiatric Medical Association report that foot problems often reveal early signs of diabetes, nerve damage, and circulation disorders. Their studies show that for adults over 65, consistent foot care and regular inspection could prevent up to 85% of diabetes-related amputations. 85%. Just imagine how many lives and limbs could be saved. Take Lionel, a 78-year-old retired machinist from Ohio. Lionel ignored dryness and small cuts on his feet, assuming they were just normal aging. "My feet always looked rough," he said. But during a routine appointment, his doctor examined his feet and immediately ordered blood tests, catching diabetes at a stage when lifestyle changes could still make a major difference. "If he hadn't looked at my feet, I would have had no idea," Lionel said. "I might have gone years without a diagnosis." What should you do now? Wash and thoroughly dry your feet every day, paying close attention between the toes where fungus grows easily. Inspect them regularly for cuts, wounds, swelling, or color changes. Wear clean socks made from breathable or moisture-wicking materials. Moisturize dry areas, just not between the toes. And never ignore numbness, swelling, or slow-healing sores. These are medical warnings that require immediate care. Are your feet cracked? Noticing cuts that don't heal? Seeing new discoloration? These aren't cosmetic concerns, they're early signs your body needs help right away. Mistake 7. Hygiene changes caused by medication. Are you taking several medications? Have you noticed changes in body odor, sweating patterns, or dry mouth since starting them? Many prescriptions that help your health can also cause hygiene changes that point to serious side effects. Experts at the American Geriatric Society document how certain common medications cause issues like dry mouth, unusual body odor, or excessive sweating, all of which can signal possible toxicity. Their research shows that in older adults, nearly 40% of negative drug reactions first appear through changes in hygiene before more alarming symptoms show up. Take Jeanette, a 66-year-old former medical assistant from Georgia. Her family thought her unusual body odor was a hygiene issue until her geriatric specialist recognized it as a sign of medication buildup affecting her liver. "I was bathing every day and using deodorant," Jeanette explained. "I had no idea the smell was coming from the inside." Her medication had to be adjusted immediately to prevent long-term organ damage. What can you do? Keep track of hygiene changes after starting any new medication. Write down shifts in sweating, odor, dryness, or skin texture. Stay well hydrated unless your doctor tells you otherwise. Report unusual symptoms immediately. They may reveal interactions or dangerous side effects. And never change your medication dosage without medical supervision. Have you noticed strange body odor, intense dryness, sudden sweating? Don't shrug it off as aging. These changes may be early signs of something serious. Now you understand the 7 hygiene mistakes doctors watch for in older adults, and exactly how you can avoid them. Addressing these issues now can prevent major health problems, protect your independence, and even extend your life. Remember, hygiene isn't just about appearance. It's a critical part of staying healthy as you age, and these simple habits could truly save your life. If you found this helpful, please hit the like button. Has a doctor ever mentioned any of these issues to you? Share your story in the comments. Make sure to subscribe and turn on notifications for more life-saving senior health information. And please share this with someone over 60. You could change their life.